So good afternoon, and we're thrilled to be here today at the Boston Youth Barbecue Van and the Basketball Bash at the DeWitt Center. Just want to know, is there anybody here who thinks they're going to win the Basketball Bash? No. But thanks. This event is, as you all know, is being sponsored by CIC Health and by Blue Cross Blue Shield and Madison Park Development Corporation and a number of other local partners. It's a fun, community-based event that's aimed at getting kids who are between the ages of 12 and 17 vaccinated by using a variety of incentives like raffles and games and, of course, the free barbecue. And it's at the DeWitt Center in Roxbury, which is one of those areas around the city where we're working on increasing our vaccine numbers every single day. The event leverages trusted partners as well as well-known institutions like MPDC to reach populations who haven't yet been vaccinated. It's an example of the kinds of targeted community-based efforts that have helped Massachusetts lead the nation in vaccinations. I can't stress this enough, now more than ever. It's important for anybody who isn't vaccinated to get vaccinated. It's free, it's safe, it's available to anyone who lives or works in Massachusetts. You don't need an ID or insurance, and this clinic is one of 900 sites people can get their shots in every corner of the Commonwealth. We're making this as easy as we possibly can for everyone so that everyone who has a chance will get vaccinated. And that is why Massachusetts continues to be a national leader in vaccinations. In fact, we'll even come to your home if you can't make it to a clinic. And make no mistake, these vaccines are lifesavers. They're the single most powerful tool we have in fighting the pandemic. Only 0.15%, 6,373 people of the 4.3 million fully vaccinated people here in Massachusetts have tested positive for COVID. Only 0.008% of those individuals, 361, have been hospitalized. These vaccines are why we have been and will continue to move forward here in Massachusetts. They're your best protection. They're your parents' best protection. They're your family's best protection against COVID. So please, if you haven't gotten vaccinated, get vaccinated. Now, as you all know, earlier today we updated the Department of Public Health. I'm just going to wait a second here. Earlier today, we updated the Department of Public Health's face covering guidance to reflect the new information out of the CDC. This new guidance was developed to be as simple and as straightforward as possible. And we also tailored it to Massachusetts. We've made significant progress in the COVID fight. We lead the nation in vaccination rates among big states, and as a result, we have one of the lowest hospitalization rates in the country. The vaccines work, and we're going to continue to do everything we can to make sure everyone who wants one can get one and can get one easily. Making vaccines readily available and releasing the best public health guidance possible is how we've been able to beat back COVID. As long as there are unvaccinated people in Massachusetts, we're likely going to see additional positive cases. But thankfully, the high vaccination rate here resulted in far fewer people getting sick. That means the vaccines are working. And going forward, we're going to do everything we can to make vaccines and COVID testing available. We're also going to monitor the data and give the people of Massachusetts the best possible public health information in as simple and straightforward a way as we possibly can. That way, everyone can take the right precautions for their specific healthcare needs, and that's what today's guidance is all about. If you have a serious health condition or are at serious risk of developing severe illness from COVID, you should take extra precautions. If you have a close friend or family members who have a serious health condition or are at serious risk of developing a severe disease or illness from COVID, you should take extra precautions. If you're not sure, or you have concerns about your personal health or that of a family member, you should consult your healthcare provider. And remember, please get vaccinated if you haven't. That's your best possible protection from COVID. Now, as a result of the fallout from the Provincetown cluster, we've been conducting daily testing of unvaccinated employees who work in long-term care facilities in Barnstable County daily. As you may know, we'll continue to conduct weekly COVID surveillance testing of both residents and staff in all long-term care facilities in Massachusetts. We've also stepped up our rapid response teams, which were tremendously helpful in the fall in working with our colleagues in long-term care in any place where we had a cluster of cases. They will continue to do so. And we'll also continue to conduct weekly COVID surveillance testing in all congregate care settings under the jurisdiction of the Department of Health and Human Services, and the Department of Correction will continue to regularly test staff and inmates in their facilities. We'll continue to discuss other possible measures with our colleagues in the senior and long-term care community to make sure we're doing all we can to keep seniors as safe as possible, as they are among the most vulnerable. With respect to public schools, our Department of Elementary and Secondary Education and our Department of Public Health just released recommendations for public schools for this fall. Again, they're recommendations that are based on the new CDC information and on the state of the pandemic here in Massachusetts. We fully expect cities and towns to make adjustments to do what's right for their specific school districts. But one thing's clear: all schools in all districts must be open every day to every student, no matter what. The documented negative impact on children that resulted from the uneven, unpredictable, and profoundly difficult year that students had last year cannot and must not happen again. In-person learning is the only available option for Massachusetts schools and their students. And hopefully today's guidance will help local officials finish their preparations as they get ready to welcome back their students in the fall. Massachusetts is moving forward in this new normal, and we're moving forward safely. Our job is to continue to make sure everyone has the protections that are made possible by the vaccines. And we'll make sure that everybody has the best possible public health information so that they can make the right decisions about their specific health conditions, and we will continue to double down to protect those who are most at risk here in Massachusetts. And today's guidance is another way we can work together to stay healthy and safe. Thanks.